So something crazy about South Africa is that you can sit in a hospital, have the power go off for, now it's been like 8 minutes plus. So about, the power's been off 15 minutes without a generator kicking in. And I thought pregnancy brain was a real thing. I just got the results back from my blood glucose test, and I have gestational diabetes. I am disappointed because I made a lot of lifestyle changes with this pregnancy, and I'm quite shocked. Like, I really didn't feel that I was going to develop it this time around. However, I am very grateful because last time they caught it quite late. I was already past 7 months pregnant, and I'm 24 weeks this week, so thankfully they caught it early, and thankfully I live in a country where I'm receiving healthcare. Yes, we have our little power outages at the hospital, etc., but for the most part I'm very, very grateful because at least they found out at 24 weeks that I have gestational diabetes. They took more blood. I'll go home now and Google and see what that's all about, because they want to see me on Wednesday. They did a urine test. So I'll be back in 4 days. No, wait. My math. Okay, I'll be back in a few days. And yeah, what can I say? I will have to manage this, and I'm thankful that I know. And I am disappointed, and they say the baby looks healthy, so that's all that really matters. On the road again, ba-ba-ba-da, on the road again. Oh, we're always busy. We're always on the road. Hey?
Yeah, hey, yes.
So what are we up to now?
We're gonna make our cardboard Titanic with bigger boxes.
We're gonna go to the shops now, and then we're going to get cardboard, and we're gonna build a cardboard Titanic. It's an ongoing process. We're not gonna do it in one day. Rome wasn't built in a day. But it's scorcher today. I had a 20-minute power nap.
Yes.
And Vic came home. And now we took a nice bath. Ice bath.
Yes.
And now we're just gonna take it easy. Go to the shops, get our stuff, come back home and chill. It's the weekend, guys.
Yes.
Are you puffed out, boy?
Yes.
I'm puffed out as well. Just like with everything in South Africa, we went from 0 to 100 in a question of 2 weeks.
Yes.
It was freezing just like 2 weeks ago, right?
Yes.
And now we are really dying of the heat. I do look like I have a nice glow, but anyway. So we got some movies, we got boxes, and we're gonna go chill now and probably take another ice bath. What do you think?
Yes.
Bum, ba-da-dum, ba-da-dum, ba-da-ba-da-ba-da. I'm back with gestational diabetes. What? Too soon? This is life, and the only constant is change. So yes, I was a bit disappointed hearing that I'll be dealing with gestational diabetes for the second time around, especially since I made a lot of lifestyle changes with this pregnancy. But I'm gonna have to make more lifestyle changes. And I do it with love because I love my son and I love myself, and I want to be happy, and I want him to be happy, and I want us to be healthy. So yes, obviously I'm a bit what is the appropriate emotion that I could describe? I don't like the fact that I'm going to have to deal with this again, but life is a constantly changing thing, and it's not the strong that survive, it's the one that is able to adapt best, which is the survivor. And I want to be a survivor in life, and I want my children to be survivors in life. So I am thankful that I have a good support system in God and a good support system in my fiancé, and that I'm actually with a medical team that will provide me good medical care and that will help me with a comprehensive treatment plan. So I'm thankful for that. And speaking about that, I'm seeing the doctor again on Wednesday because he ordered some tests to be done, 4 tests exactly, and naturally I Googled them. So the tests that I was super inquisitive to know what they're all about is the U&E test, the UA test, the HbA1c, the FBC, and platelets. So the U&E is the urea and electrolytes test, and this is the most commonly requested biochemistry test. And this test provides essential information on your renal function. This test's critical value is in the diagnosis and management of acute kidney injury and chronic disease. So if this is left untreated, it can lead to thrombosis, cardiovascular disease such as myocardial infarction, and stroke. So it's a pivotal test to do, especially for your kidney function. And they look at the creatinine levels. It's a major factor in determining the estimate glomerular filtration rate, which is the gold standard marker of kidney health. Let's pretend that I know what I just read. I have no idea. I know it has something to do with your kidney function, and that's awesome. And I'm sure that the doctor will be going through any vital information with me on Wednesday. So the second test is the uric acid test. I'm sure many people are familiar with it, and this measures the amount of uric acid in your blood and your urine. So uric acid is a normal waste product that's made when the body breaks down chemicals called purines. Purines are substances found in your own cells as well as some foods. And most uric acid dissolves in your blood. And then it goes to your kidneys, and from there it's excreted through urine. But if your body makes too much uric acid or doesn't release enough into your urine, it can make crystals that form in your joints. And this condition is known as gout. It can also cause other disorders, including kidney stones, kidney failure, and very interestingly enough, preeclampsia. Never knew. Yesterday when I got to the hospital, after the load shedding, they tested my blood pressure, heart rate, etc. And they notified the doctor, like, way too high. So I am dealing with high blood pressure. And yeah, let's see what happens on Wednesday. I'm naturally going to keep you updated. The HbA1c test measures the amount of blood sugar or glucose attached to your hemoglobin. Hemoglobin is the part of your red blood cells that contains oxygen or carries the oxygen from your lungs to the rest of your body. And this test this is very interesting. Like, I loved reading this. This test shows that the average amount of glucose attached to your hemoglobin, what that has been like for the past 3 months. And the reason for this is because insert example of pregnancy brain. It's a 3-month measurement test because 3 months is the average lifespan of a red blood cell. Like, so interesting. I love reading this stuff and pretending that I know what it means in its entirety. Please, here's an disclaimer. I'm not a medical professional and I'm just doing this for myself. So please consult your doctor. So if your HbA1c levels are high, it may be a sign of diabetes, which can cause serious health problems. This test is used to monitor your condition and glucose levels when in fact they already know that you have diabetes, which, yeah, they told me yesterday. The last one is the FBC and platelets test. And this is a full blood count. It's a very common clinical procedure and is often the starting point for many medical investigations. This test is not only a test for disorders or abnormalities of the blood cells, but that's also what they look for. I think the reason this blood test was ordered was because I told the doctor that I have a hereditary condition called spherocytosis, in which my red blood cells are not concave, but round with little spikes on them. And it affects the way that they interact with white blood cells, and it also affects the way that it moves through my body and obviously through my organs. So I have an enlarged spleen and an enlarged liver. They diagnosed this in me when I was 2 years old. So it's something I've dealt with forever. But interestingly enough, with my previous pregnancy, they actually wanted to take my spleen out. And I was like, no. I don't like anything missing from my body. Let's see what happens this time. Let's take it as it goes. But yeah, I think that is one of the reasons. I'm not exactly sure how it would impact pregnancy, apart from the fact that pregnancy puts strain on your entire system. So that's that. Blood is made up from 3 main types of blood cells, which is the red blood cells, the white blood cells, and platelets. And the number of cells present, the size and proportions of these cells, the hemoglobin levels, all of this is measured in this FBC test. So I love this. This is so interesting. Like I've said in a previous vlog, my grandfather was a doctor, and many people with my surname, Bergholz, are doctors. So I love reading stuff on Google and feeling like I know what I'm reading. However, the application thereof in a holistic effort toward health is something that we need doctors for, that we need healthcare professionals for, and that's why they spend so much of their life not only acquiring skill but knowledge and the application of their knowledge and skill. So shout out to doctors, nurses, and everybody in the medical profession. I have so much respect for you, and thank you for being there for us. Guys, thank you for joining me for BabyBumpVlog today. And thank you for your prayers and everything. I really appreciate it. Please, if you like this content and if you want to have more of it, subscribe, like the video. If you've dealt with gestational diabetes in your pregnancies, please hit me up. You can comment down below. You can follow me on Instagram. at BabyBumpVlog and leave a comment. But I definitely want to hear from you, mommies.